that's really great news. And it brings me to the next topic. I've talked about this also in some of my posts. For women who look at the nipple in a couple of different ways. One is cosmetic. A breast, with its nipple, it's sort of very a characteristic organ. It has a lot of symbolism to it. Has a lot to do with the look of a woman. I find it, more common amongst more mature women to say, maybe we won't reconstruct the nipple, or maybe I don't care that much. But even then, if you give them the opportunity to spare it, most would probably take that opportunity. But the other important and less talked about issue is sexual sensation to the nipple. I've had patients who have told me, I live and die by, the eroticism of my nipple. And after this procedure, what's going to happen? Years back when I was practicing, I had to tell them, unfortunately, I cannot guarantee you that we will be able to spare any of that. Most women get back, normal hot, cold sensation, maybe some rudimentary skin sensation, but that specialized erotic tissue usually was something that had to be sacrificed. So this whole neurotization and transplant of specialized tissue so that sexual sensation can be restored is fascinating, and one of the newest areas of research that I know is going on. And I know you're pioneering it, so I'd love for you to talk about it.
Yes, sensation is a really huge issue in mastectomy, and absolutely agree. It is not talked about enough. In fact, many women actually don't know they will lose sensation until after. Sometimes they're surprised because there's a lot of focus on the oncological side, on treatment. Obviously, that's kind of the priority, but the trade-offs that happen with a mastectomy sometimes aren't discussed, and losing sensation is one of them. When you look at sensation, there's actually different parts of sensation. As you mentioned, there is erogenous sensation, there is pain, there is temperature, there is vibration. There are a lot of different types of neural sensors that we have. And when we talk about restoring sensation, unfortunately, erogenous sensation is very, very difficult to restore. In fact, I never really set that expectation up for my patients.
Yeah,
I think it's
that's the
really
right thing to do. Yeah.
I think it's really important for patients to know that there are limitations in what we can do. But restoring sensory protective sensation is absolutely something we can do, which is really amazing because we can now essentially, when I use the patient's own tissue for reconstruction, I routinely connect the nerves. So the nerves that are cut with the mastectomy, I connect to the nerves of the tissue we're transplanting. So essentially, there is ingrowth of nerves, and then that tissue sort of serves as a conduit for more sensation to, over time, improve in the mastectomy skin. So over time, patients do get improved sensation. And for many, many years, we thought that neurotization or restoration of sensation was only possible when we're using the patient's own tissue. But thankfully, in the several few recent years, we have pioneered new techniques for patients that have implant-based reconstruction. Now we can actually utilize nerve grafts that we can connect to those nerves that are cut with the mastectomy, and we can use those as little roads for nerves to grow, and we actually position them to grow right under the nipple areola complex.
And they grow fast, not like the 7 years that it takes for nerves to grow back. They grow quickly.
So, so nerves grow about a millimeter a day. And so if you're looking at that distance, we usually say that it's like an 8 month timeline. And what's
Wow,
interesting
it's
is oftentimes
impressive.
patients get, little kind of pins and needles and zingers because that's actually a sign that the nerve is growing.
Yep.
So it's been really an exciting development. I think in my practice, I have been doing that for about 7 or 8 years. routinely for my implant-based reconstructions as well.
I